Hello and welcome to our very exciting talk. Has anybody seen my libido? If you are maybe wondering where your libido has went, or maybe your partner and you are wondering where your libido has gone, tonight is for you. So my name is Laura Rademacher. I'm a licensed marriage and family therapist, and I'm also an AASECT certified sex therapist. So I work with lots of people around sexual issues, including low desire, loss of libido, and I am so lucky to be here tonight with Andrea Zimmerman and Ivy Emory, who are both board certified women's health nurse practitioners, and they're also the owners and clinical specialists at Harmoni Wellness. Hi, you two.
Hello. Thank you
Hi,
for
Laura.
having us.
Oh, I'm so excited about our conversation tonight. So tell me just a little bit about what you two do over at Harmoni Wellness.
Thank you. Yes, at Harmony, we serve individuals. We do a lot of education. We want to understand what's important to our clients, and we offer options that are evidence-based. We can make recommendations, and then we make a decision together with our client on what we're going to do to move forward to address their concerns. We also do educational events in the community. So we have hosted smaller groups and larger groups. We can talk about books and research articles. We can answer questions, do the Q&A kind of format. And we've also screened the documentary, The M Factor, Shredding the Silence on Menopause.
Well, I think that's probably going to factor into some of what we're going to talk about tonight, is possibly menopause and perimenopause, and all of those changes. So you all do procedures, right? And do you work with hormones?
We absolutely do. We prescribe bioidentical hormone therapy for usually women who are coming in and saying things like, something's changed. I don't feel like myself. I saw my regular doctor, or I went to see my OBGYN. I had my labs done and they told me everything looked fine, but I just don't feel fine. And we start digging into what's really going on. When did you start noticing changes? What are those changes? And frequently, what we discover is there has been some sort of life change that has caused a shift in a woman's hormones. Maybe it's, post pregnancy. Maybe it's just before her period. Maybe she's having a difficult time ovulating. Maybe it's the beginnings of perimenopause, which can start in your late 30s, early 40s. And most women are not aware that their hormones are beginning to change when they're that young. And so they know something doesn't feel right, but they're really having a hard time putting their finger on it. And usually someone in their life will mention, have you thought about having your hormones checked? And then they find us.
And I'm so glad that they do find you, because this is really important stuff, So for me, as a talk therapist, I talk with lots of different people about their sexual selves, their sex lives, both solo or with partners, if there are partners involved. And one of the things that I hear a lot is, I have this sense that something is changing, but I don't exactly know what. And one of the things that I've noticed is we don't really talk, we don't get much education, most of us, about perimenopause and menopause. Certainly nothing was given in the class I had in middle school about puberty, or in any of my high school sex ed. And even in my training as a sex therapist, there wasn't a ton on perimenopause and menopause. I had to do a lot of that work on my own. And I started doing a lot of it in my late 30s when I started having perimenopause symptoms. And I was like, what is going on here? So I think, Andrea, what you said about so many times people don't realize that this kind of stuff can happen earlier than you think, and also go on for a much longer time than we sometimes anticipate.
That's really true. women start to produce fewer hormones, reproductive hormones, although our whole entire body, all of our tissues are using these hormones. We start making less of them in our late 30s. And so it's very common in our early 40s, women will start to notice something changing. The first symptoms that women generally report are changes in their menstrual cycle. They have fatigue, they're very tired. Um, they might not be sleeping as well. Loss of libido is a major concern that they have. Um, and weight gain around their middle. Those are the things that generally women will notice, and it drives them crazy that they can't figure out how to fix these things themselves, and trying to power through it isn't working. They just don't feel right. Um, and I think most women are unaware that this period of perimenopause, the years leading up to menopause, they are manufacturing less of these estrogen, progesterone, testosterone until they hit menopause. That can be up to 10 years sometimes until women are fully menopausal. The average age of menopause in the United States is 51 for Caucasian women. For Latina women and African American women, it's earlier. Their
Okay.
symptoms are more severe and they last longer than Caucasian women. So it's even more nuanced than just, oh, I'm in my late 30s. It really has to do with culture, ethnicity, your environment. It's a real puzzle.
Well, it makes sense to me in a way that that it's a puzzle, because the things that I see people coming in and talking about are oftentimes at this stage of life, people have young children. And they will have noticed, okay, around the time when I was having children, I was tired. Everybody was tired. It was a huge life change. To some degree, it was expected that my desire was lower. Sometimes people are still carrying like body injuries or pelvic floor injuries, even years later, or they're worrying about some kinds of incontinence issues or something like that that might still be around. And then you add on um, the stress of this stage of life, which is often a time where people have a lot of pressure around careers. They've got maybe kids that are doing a whole lot of stuff. They maybe have a partner who has, I don't know, adds to the mix, hopefully supports in the mix, but it's just a lot of needs going around. And it's also a time when we don't really see women represented as being sexy. There's not a whole lot of, I don't know, really great role models being created out there in Hollywood for this time of life. And so I think um, that's part of what I see for people when they're really struggling with libido and desire issues. Do you see some of that too?
Yes, definitely. And you've described our clientele pretty much.
Yeah.
And we approach every client with the knowledge that their capacity for their energy, for their brain space, and just even their physical burdens that they're carrying, and that they're not sleeping, they're having disruption, um, that it's exhausting. But two things can be true at once, and I think that it's really reassuring to the folks that we talk to understand that, sure, there are external factors that are definitely involved. There's biology involved. And when we start to educate folks about the biologic process, there are sometimes tears of relief when we get the labs back and we're able to show that testosterone is low. Sometimes people feel so validated in what they've already known or what we've explained, then they're like, I knew something was wrong and I have been asking for help, but I haven't really been getting the help, or I haven't really been able to put my finger on it. Another thing that is really confusing for people is that it's not a steady decline. It's fluctuating. The brain is demanding more estrogen. The ovaries are like responding, but they're not responding in a predictable pattern. So sometimes people are hitting this low in their hormones that's producing symptoms, and then the symptoms are gone. And so it's a moving target that really can mess with people's minds. So the education piece of this is what's coming, this is what's typical for some people. It's just really helpful to prepare people for what's coming and then get the support that they need. And something that's really important about our practice is we always are holding that mental health um, concerns or the feelings at the center of it, of what we do. If someone's having incontinence, they're going to have feelings about that. If someone's having a low libido, they're going to have feelings about that. So really being a safe space for people to really talk about normal things that happen to us. And yes, it is absolutely normal, but we do not need to live with this. And understanding that piece, we really want to make sure that we hold the goal of the individual at the heart of what we do. In our culture, there's a lot of pressure that we have to be sexy or that we have to feel sexy. That is an external goal. So if we have an individual coming to see us, we want to understand, what does libido mean to you and what does it mean to your partner? And if there's not a problem here, if you're at a libido match and maybe you're both at low libido and you're finding other ways to express intimacy, to feel close to each other, you're in a loving relationship and you just are not at that point where you're feeling like sexual beings, then there is no issue here. And I had someone actually thank me for explaining it that way because they felt absolutely secure in their relationship, but they said, thank you for saying that, because I mean, I said, I don't see an issue here if there's no issue between you two. So it's a lot of conversation and being able to take the time to really, in a compassionate and caring way, and trying to create that trust right away so they can tell us the complicated feelings behind libido. Then we get to the root of it and we can offer options.
Yeah, Ivy, I love everything that you just said. And it makes me think about, I do a lot of work with individuals, I do a lot of work with couples, and sometimes the partner has some things to sort out about all this too, right? So in order to, it's always for each one of us, it's always our decision about, do I even feel like I want to put effort into being sexual right now? Maybe I don't. And that is totally, totally fine. I've found that it can be helpful to partners sometimes to know some of the things that you all have been saying about, like, look, hormones change around this time. There are life stressors that have real impacts on sexuality, because sometimes partners are thinking, is it me? Like, is it, or is it us together? Or what's happening here? And so I think that's one of the things that can be really important, is having that kind of conversation of, we all want different things for our sex lives at different times in our lives. Sometimes we might feel like we're really into having a sexual relationship, and sometimes less so. And that doesn't mean that the romantic part of our relationship has faded, not necessarily, at least. Doesn't necessarily mean that there's anything wrong with the relationship. It could be that there could be stressors going on, right, in a relationship, or it could just be changes, and like you said, the person you talked to who is just very secure in their relationship and also was like, yeah, I'm not really interested in sex. It's like, well, wonderful, great, you figured that out. But I do think it's nice for everybody involved to kind of have an idea of, there's a lot of factors that make your libido potentially hide for certain points in life.
And people feel differently about their libido. Some people feel a ding in their confidence if there is a libido change for them and they want to feel sexual. It's not just an absence of that feeling or that desire. And, it's not always a disappointment because they want to have that intimacy with their partner, or that's how they express that, or they know that their partner is disappointed. Sometimes it's something is really different with me. I used to feel sexual and confident, and it makes me feel not as confident. So it's a very, it's a very complicated discussion around libido. And so we take a lot of time to just try to unpack it as much as we can. And excuse me, we stay in close contact with our clients. So we have an opportunity to be able to follow up and maybe have more conversations around what we started and after they get to know us. And, it's not just sort of a one and done where people are coming in and sharing their most private thoughts and feelings. And then, to a stranger, hopefully we're building a relationship that's going to keep going, and then they feel confident to share with us, or if something occurs to them later and they can reach out and tell us about it.
That's pretty wonderful, because so many people really don't have a whole lot of support around these issues. So it's really wonderful to know that they can always reach out later and connect, or dive deeper into this. Yeah. Should we talk about if people want to work on their libido or their desire? Should we talk about what some options are?
Absolutely. We have a number of things that we talk about and offer at Harmony. The first thing that we are wanting to know, obviously, is this a relationship issue, or is this something that we can kind of come at solutions with your physical body or the tissue that we're working with? We are big fans of hormone replacement, but hormone replacement cannot fix a damaged relationship. So we really try to get to the root of where we think the loss of libido is coming from, and then have a rich conversation about what we can offer. Um, Bioidentical hormone replacement therapy is helpful for clients. Testosterone, in particular, is the fastest way that I can help the mood of libido be replaced in the brain. And that is appropriate for young women who are still menstruating, regularly, young women being in their, late 30s, early 40s. Uh, Testosterone begins to wane in their 30s, and they start to feel loss of libido pretty quickly. And so late 30s, early 40s, it's fairly common. So hormone replacement is one tool that we can use. There is a prescription medicine that became available just this year on the market. It's called flibanserin, or Addyi. Addyi is the brand name. You can't prescribe it yet as a generic. It's an expensive medication, and it's something that you take every single day. It's not something that you take just before you wanted to have intercourse. It's something that works in the brain with our neurotransmitters, and it suppresses serotonin. Serotonin can suppress our sex drive. And so it enhances some neurotransmitters that are supportive of libido, and it quiets down the neurotransmitter that can depress our libido. And it's a fairly new medication. It does have some side effects, and it could potentially be hard on your liver. So if we prescribe that medication, I want to see my patient every 3 months to check her liver labs. So, there's some extra work that goes into using Addyi, but it does have some very good response record from women that are using it. So that's a brand new medication on the market specifically for perimenopausal women. So, Addyi is an option, a non-hormonal option for perimenopausal women who do want help with libido.
Yes, and whenever we're evaluating for what are some good options to get started, we usually will start with the hormone piece, because we want to address root cause. So if we're going to talk about testosterone, we're also going to talk about the other mental health benefits of testosterone regarding ambition, drive, confidence, libido. Obviously, it's a really big puzzle piece of libido, even though estrogen does have some benefits as well. And I would argue progesterone, if they're getting good sleep, then maybe libido is perking up too. So really looking at the root cause and understanding that we're addressing symptoms, but we're also looking at long-term, decreasing long-term risk of disease. And a big puzzle piece for testosterone is also building new lean muscle, maintaining lean muscle, and not wasting lean muscle. We know that that is going to be beneficial for cardiovascular health, metabolic health, and for bones. So that's usually where we're starting before we're offering more options.
So I'm hearing that there on the more medical side of things, there's some hormonal options, there's some non-hormonal options. I think that's great to know that there are things to try no matter what direction seems like it's the best fit for you. And I also loved hearing you both talk about how you are careful to see if it's a relationship issue or I would also say a life stress issue. Because when people come to my practice and talk to me and say, I just don't know where my desire went, sometimes it's a relationship issue. Even if you have a great relationship, sometimes you've gotten into like a cycle with sex where maybe there's one partner that's trying to initiate all the time and the other partner that's saying a lot of no thank you. And it's got people feeling like they don't even want to talk about sex because it's so stressful to be in this cycle together. So I wanted to tell you about just two things really briefly that have been really helpful for some of my clients. One is the idea of sexual breaks and accelerators. And our sexual breaks are going to be different for all of us. If you sat and thought about it, you could probably name a few of them off the top of your head right now of feeling like my kids are going to hear, feeling like I'm still stressed out about my work day that I came home from. I have just the tiniest moment where I feel sexy and then I look at the pile of laundry over there and I'm like, well, never mind. Those would be our sexual breaks. And then there's sexual accelerators, the things that get us going, our sexual inspiration. And just like if you're driving a car, if you're trying to go somewhere, a lot of people's first move is, I need to go for the accelerator, right? So a lot of times people will, maybe a partner is going to bring home a toy or some underwear they think is sexy, or they're going to try to put on some kind of like sexy movie and leaning into that accelerator. But if your brakes are to the floor, you're not going anywhere, right? You just revving your engine. So working on how do you let up on some of those breaks? Not that it's something that you're doing on purpose and not that you're totally in control over it, but what can we do in life? How can we adjust things so that those breaks feel a little bit lighter? And then there's also the concept of spontaneous and responsive desire. And for both of these concepts, the best resource I've seen is the book Come As You Are by Dr. Emily Nagoski. So if you want to learn more about this, that's a great resource. But spontaneous desire is what you see in the movies a lot, right? Two people see each other, their eyes meet, and the next scene you see is them ripping each other's clothes off. They're not talking about what they might want to do, what they don't want to do. They're just apparently just really in the mood and going for it. So spontaneous desire is kind of immediate in the body. It just starts to happen. But there's also responsive desire. And we almost never see that in movies or anywhere else. And responsive desire is just like its name, it responds to something. So you have to be doing something sexy, thinking something sexy, watching something sexy, reading something sexy in order to inspire this responsive desire. And sometimes you need to do that for 10, 15, 20 minutes before you really know whether or not your body's going to kick in and be like, yes, I'm into this, which creates some really interesting and sometimes difficult communication dynamics between partners, where maybe one is really hoping that this is going to go somewhere and is like, we've been doing some sexy things for 15 minutes. And the other person's like, yeah, guess what? It's not happening, or just is avoiding trying anything fun because they don't want to have to be disappointing if it doesn't kick in. So if these are some of the things that are happening to you, talk to a sex therapist, this is what we do. Like I said, the book Come As You Are is a really great resource for that too. So
Great.
have we found their libido yet?
Well,
Maybe
I
not.
think one important thing to also address is the function piece. And there is a lot of consideration to where did the libido go? Where did this start? And we have a lot of folks that have pain with intercourse or dryness, atrophy. So we do address those. We have hormonal and non-hormonal ways to address it. We also do treatments. You had mentioned before procedures, and we usually call them treatments. It's self-care and there's no downtime. And some of it is even client-led with the therapies, which I really like to give that autonomy whenever I can to the clients to participate in the therapy. But we've had really good results, and we're talking about reducing painful intercourse and even helping with reduced sensation. So, I'm still able to achieve an orgasm. It just doesn't have the same quality as it did before. And then how do you share that with your partner? And then there's disappointment and those kinds of things. So the functional piece is important too.
I love the way that you just said that. And you like to call it treatments?
Yes.
Which
Treatment.
sounds more like you get to go to the spa, and which is,
Mm-hmm.
part of what you're doing is like bringing back pleasure, bringing back that good feeling, because
Mm-hmm.
anybody who is experiencing dryness or pain is not going to be excited about being sexual
Mm-hmm.
in any way. I talk with a lot of people who have kept their pain to themselves for a long time, and that's not good for anybody. But they often do it because they don't think that there's going to be treatment available, and clearly there is. And also, it tends to really cause a lot of resentment in relationships, and it's not pleasurable. It's not fun. Nobody really wants to be sexual if it's going to hurt. So, oh my goodness, if that's happening to you, please find some help and some support.
We have more options now than we ever have before that are safe and effective.
We have had so many patients meet us and they report, I talked to my provider about this and they said, this is just the way it is. So in their mind, they saw a specialist and they were told that your problem can't be fixed. You need to go home and just normalize this. This is the way it's going to be for forever. Or occasionally, unfortunately, we hear bad medical advice like you just need to keep having sex. It's like a use it or lose it. So if a woman's saying it feels like razors when I have intercourse, and what she hears from her provider is the only way to fix it is keep having intercourse, she's done. And she doesn't ask any more questions of anybody else because she already went to a doctor and she trusts that doctor to or provider to have given them expert advice. And so she just assumes, well, I guess it's done because that was too painful. I'm never doing that again. And that part of the relationship really suffers. And then it's two people involved, which really is a shame. So Ivy and I really, just want to get the education out there, start to normalize this conversation. It is absolutely normal to want to have a libido and a satisfying sex life. If that's what you want, it's okay to have it, and it's okay to ask for it and ask for help if you're not able to figure it out all by yourself.
Yeah, Andrea, thank you for saying that, because I have heard a lot of the same thing. I've heard a lot of people saying, I talked to my doctor about this and my doctor didn't know what to do or said there wasn't anything to do, or having some kind of bad medical experience and then thinking, oh, I guess I just shouldn't have brought that up. Oh, my doctor acted embarrassed, so I guess I shouldn't have brought that up. And I mean, I think that probably so many medical professionals just don't have the specialized training in this. And also, medical professionals on the whole, just like therapists on the whole, don't get a whole lot of training in sexuality unless they specialize in it. And so, if you've had that experience, with a medical professional or a mental health professional where you have asked for help around a sexual something and you've gotten a bad response or you've been told there's nothing that can be done, that's not on you. Keep asking. Find people like Andrea and Ivy over at Harmoni Wellness. Come see a certified sex therapist or someone who has a lot of training in sexuality. And it's always okay it's good to get a second opinion because someone might know of an option you haven't tried. So one of
Another
my,
resource. Oh, I'm so
yeah,
sorry.
no, please go ahead.
Another resource that Andrea and I really, really love is Dr. Kelly Casperson. She has the podcast, You're Not Broken. She has a book called You're Not Broken. And she explores all different kinds of sexuality. She's actually a urologist, which gives her a really different sort of view about incontinence and vaginal health and maintaining tissue and pH balance. And then she became a menopause champion through this work and also a sexual health champion. So she is really easy to listen to on her podcast. She'll talk about all different kinds of topics. And her book, You're Not Broken, really is focused around more of libido and sexual health and the function and the mental health piece.
You know, I'm just having the thought as we're talking about pain and pain with sex, we should take a minute to talk about pleasure and remind people that sex can be anything you want it to be. It doesn't have to be any specific behavior. It doesn't have to be with another person. And that really one of the keys to having really great sex is to just focus on pleasure and not worry about any kinds of expectations that you might be putting on yourself. If there's certain sexual behaviors that are not fun for you and are not pleasurable, and you're really not interested in working on them, maybe don't. Maybe focus in on the ones that you enjoy. Not everybody likes penetration the best. Not everybody likes penetration at all. There's so many different ways that you can be sexual, and it's great to just lean into what you like and let go of those expectations that might be holding you back.
I support that 1,000%. And I think that has everything to do with communication. And I think the references, the books that we talked about are meant to help women understand a little bit more about that in their internal life and come around to that then in a physical way.
Yeah. And if you are having any struggles with communication around that, or maybe you have a partner that says, but that's a thing that I really want to have in my life, I'll just say, like, that's what I do. Come see a sex therapist. We help people work through that stuff all the time. But again, remember, right? Each person gets to decide what they want to do or not do as a sexual person. And even if you have a partner, that doesn't mean that you have to be doing anything sexually if it's not going well for you. And oftentimes there's a lot of area in between to find something that's going to work well for both people if that's what's coming up.
Well,
Yeah,
and life keeps changing too. So the circumstances around you change over time. You have to keep revisiting that conversation. The decisions that you made and the things that worked well for you in your mid 20s are probably not serving you incredibly well in your mid 50s. Life is very different
that's a
at those
great point.
times. And so why wouldn't how your body feels or what you're interested in also have changed?
That's a great point. Yeah. So one of the things that I know has helped a lot of people with pain that I have worked with is lubrication. Do you two talk about lubrication with your clients at all?
We
So
do. We
much.
have a we have a basket of lubrication that people can sample and try different kinds of lubrication. And lubrication is more specialized than I think people understand. And there are different purposes for different kinds of lubrication. And so having honest and open conversation about lubrication and kind of demystifying it and letting people touch and feel and ask questions is really important. And something else that I think is really important is understanding that our pH balance changes too. So there are pH balance lubrications to ensure that we're not going to have some sort of infection process from exposure to the different pHs that we're not aligning with as we age. So that's really important as well. And we had visited the Smitten Kitten store in South Minneapolis, and that's where we started doing some of our recon into lubrication. But it was a really, really great place to start. They have actually someone dedicated to learning about lubrication and the different types and how it's made and different ingredients and the purpose. And it's such a sex positive experience, and no question is strange or bizarre or silly. It's all very much it's just a vibe that feels really honest and relaxed, and you can ask questions about lubrication.
Yeah, the Smitten Kitten is a really great resource. And I love that you have a basket of lube at Harmoni Wellness as well, because, and Smitten Kitten is like this too, where they have lube on the shelf that you can try. You can put it on your hands, you can taste it, make sure you like the taste, because that's important a lot of the time. And if you, wherever you are watching this from, I hope that you can find a store like that, or a resource or a clinic like this near you that has lube that you can go and put on your hand and see what it feels like. I know that Self-Serve in Albuquerque, New Mexico is a great resource. There's places like this all over the US. But there are different kinds of lube. So I'm going to really quick, if it's okay, can I talk about the 3 different kinds of lube and just talk about what people might want to look out for? So there's water-based lube. This is the kind that is most common. It's the kind where if you're going to like a big brand store, like your drugstore or whatever, you're most likely to find water-based lube. There are some great things about water-based lube. It's compatible with everything. It's never going to hurt any kind of barrier, say for sex supplies. It's never going to hurt a toy. You can just use it with everything. The problems with water-based lube are that it can dry out with friction, and so you may need to reapply. And if your tissues are already sensitive, it may not be the best option because of that. It also is the most likely to have ingredients that might be irritating to you. So unfortunately, some lubes that I've seen actually have sugar in them. I've seen lube that has honey in it and yeast sugar. So generally, you don't want to be putting anything with sugar anywhere near your vulva vagina area, because you could end up with a yeast infection. And then there's some other things. Ivy, you brought up pH, which is such an excellent point. And water-based lubes do have pH. So if you're getting a water-based lube, access some resources around figuring out if it's the right pH for you or not. And the really great lube companies will put this information on their stuff. You may have to go to their actual website to figure it out. It does sometimes take some real looking to figure that out. So if you don't want to mess with that, you might just want to try silicone lube. And silicone lube is considered hypoallergenic unless they put something else in it, like vitamin E, that people can have some kind of reaction to. But a lot of silicone-based lubes are just silicone. Always read the ingredient label of your lube, because that's going to tell you what's in it. And if you see a lot of big sounding words with own at the end, that's a silicone lube. A lot of times it'll have a couple different kinds of silicone in it. And so a lot of people who are sensitive or who've had struggles with lube in the past find that silicone lube works really well for them, that they sometimes maybe reapply, but not as much as other kinds of lube. And so that can be a really great choice. There's also oil-based lube, and probably that might not. I'll be honest, I hear different things about this. I hear from some people that are like, look, I've been using coconut oil since the 70s. I'm fine. And if I think if that's working for you, that's great. You know, it works for you. It might not work for everybody. It's really good for outside the body, like on a penis, maybe. People sometimes like it for anal play, but there, I'd be curious to hear if you two have seen anything on this. My vibe is that we don't really have the studies yet to show whether oil-based lube is creates some struggles for the vulva vagina area. What are your thoughts on this?
Sterility. My thoughts on this,
Sterility?
people that are buying like grocery store coconut oil,
Oh, yeah.
I have I haven't seen or read or heard anyone saying that in itself coconut oil is irritating to the vulva. What I'm concerned about is repeated putting your hands in a jar of coconut oil when perhaps you didn't just wash your hands in the sink, and then potentially you're applying bacteria from the last time you were sexually active onto your body. This time you're being sexually active, and now you have a bacterial overgrowth or bacteria from one part of the body that shouldn't be in another part of the body. So that's how I feel about coconut oil. If it came in a bottle with a lid that you couldn't stick your fingers into and contaminate it, I think I would feel a little bit more comfortable um, recommending it. But in terms of being on a vulva or in a vagina, I haven't treated anyone or had a physician say this is a really bad idea. I've heard them say it's pretty safe.
That is a great point. Like, think about how you're dispensing whatever you're using. Think about germs in general. Um, I've heard different things about oils being either antimicrobial, and maybe that's a good thing, but maybe it's not, because maybe it's going to affect the delicate balance of the vagina. I mean, I
Mhm.
wish we had more studies out there that were telling us more on this. But what we do know is that there's lots of really great lube options. Um, Back to the silicone, like the only thing I think you need to worry about is that it could stick to a silicone toy. So if you're using a silicone toy, you may have to consider not using your silicone lube, but you can use it with all the safer sex barriers. So that's usually one of my go-tos when people are experiencing dryness or pain. And obviously, of course, I'm telling them to see some medical professionals too. But it's always wonderful when you can go to a place where you can try all the different kinds and see what you like.
Agreed.
Yeah.
Hmm.
Smitten Kitten was great. On the West Coast, both of these places have really good websites, which is nice for people that don't live near a big city with a sex positive, nice sex store. Adam and Eve, and also Toys and Babeland. Both of them have a really nice a lube section. They have little samples, so you can take them home, see how they feel. Um, that's really nice for women to know that there's a resource that doesn't feel creepy, that are sort of female owned, female friendly sex stores to get products that they need to make themselves comfortable.
Yeah. Yeah. And you brought up too, it's nice that there's so many online resources now. You don't have to live next to one of these stores in order to seek them out.
Yeah.
So, yeah. I know you two sometimes have some toys or tools that you recommend that might help people who are experiencing pain.
We do. And it kind of depends on the source of the pain. Was it an injury during childbearing or scar tissue that didn't heal appropriately? Many women have sexual trauma. We need to address that. If that's creating anxiety, that can cause contraction in the tissue, something called vaginismus, and that's a condition we have to work through, and that's not a quick fix. Sometimes it's age related. And if there is lack of estrogen and testosterone in the tissue tends to shrink, it becomes fragile, it can thin, it does thin, and the vulva starts to retract, and the inside of the vagina begins to narrow. It doesn't moisturize as well anymore. And that's why lubricants and moisturizers become important. Vaginal estrogen becomes important. And we also have some in-office therapies that we can use to treat aging tissue, to kind of bring back sensation, bring back moisture, help the tissue regenerate. But it really does depend on the source of the problem, how you're going to try to fix it.
Yeah. And lubricants and moisturizers are not the same thing, right? I think that is
Correct.
confusing to people sometimes. Yeah.
Right.
And
I tell
honestly, I'm
patients,
less familiar with moisturizers. I know that they moisturize.
well,
And
yeah.
yeah.
And I tell patients it's like using a lotion. It only works when you're using it. It's not going to change your tissue for forever. It's just going to make you more comfortable in the moment or that day. And if you want the benefit of it, you have to keep using it daily. A lubricant is used for sexual activity. You don't use a lubricant when you have dry skin, you use a moisturizer. So that's kind of the difference there. And then vaginal estrogen is meant to put estrogen back in the tissue, which can help the tissue become healthier. And much like the tissue you had when you were younger, when you had all of your own estrogen to use and the tissue didn't need anything extra.
Yeah. So many options. And I'm
Mhm.
loving this. I'm thinking about the people that we've all seen who feel like there are not options for them, but there are so
Mhm.
many options.
There are so many
There
options.
really
And
are.
the
I'm
vaginal
sorry.
estrogen, oh, sorry. There are a lot of options, and the vaginal estrogen, the more studies that are done on vaginal estrogen, it's just showing to be safer and safer than we ever thought. And it is one of the safest uh, safety profiles that we have, and it doesn't go into our blood. It doesn't translate into the serum if we're doing low dose vaginal estrogen. So again, getting back to the root cause of what is happening with the tissue, also knowing all of the other benefits that come from replacing the vaginal estrogen right on those tissues. You can use vaginal estrogen with systemic estrogen because it doesn't go into the blood. It's not going to raise your levels unless we're using a really, really high dose of vaginal estrogen. We don't need progesterone to protect the uterine lining when we are using vaginal estrogen because it doesn't communicate with those tissues. It stays local. We also know that it helps with incontinence. It's going to help balance pH. It helps with regeneration of tissue, and it helps with lubrication. The great thing about estrogen, when it gets to tissues, it actually gives it some pliability, some malleability. So when we were talking about atrophy and de-estrogenized tissues, that is throughout our whole body. We see it in ligaments and tendons and vessels, our arteries, bones, and the vagina. So if we are replacing what the tissue is missing, we have an opportunity to get to root cause and meet symptoms and long-term disease risk. And also, if we need anything more, then we have all these other options as well.
Isn't it great how sexual health feeds into our overall health and well-being, that it's all connected? And I just want to say again, if anybody's ever made you feel embarrassed about bringing up sexual health concerns to a professional, don't be embarrassed. This is important stuff. Yeah.
Absolutely.
Yeah.
It is. It's a huge part of our life. And even though in our culture, it's really not something you can just bring up in public and talk about freely, it doesn't mean that it isn't important. And it doesn't mean that it can't be addressed if you're struggling.
Yeah. I love that. You two talked about the narrowing of the vaginal canal. And I know that there are dilators available for that. Do you want to talk a little bit about some of that? And I'll chime in too if I have information.
Well, Vaginal dilators, if you think about them as a graduated set of dildos, if you will, they're made to go inside the vagina to help women um, kind of get used to the sensation of that pressure against the tissue in an environment that's non-pressured. This is therapy that she does privately, spending some time working with that tissue, trying to get comfortable with inserting anything inside the vagina. There are patients who have narrowed tissue. If you tried to even insert a tampon or a finger in the tissue, it would be very, very uncomfortable for them. So um, that is therapy that takes time, it takes patience. And patients have told me it works. It's like physical therapy in a way, like it works for them. They have good results while they're doing the therapy. But if they stop doing the therapy, the benefits go away. So it's something you need some patience to work on. And there are different sets of dilators that you can purchase. You really need to work with a provider to figure out what's appropriate for the body. Vaginal estrogen is usually part of that therapy. It can really help the condition of the tissue that you're working with. But patients that do have the time and the patience to work with it, they tend to have good results while they're actively working with the tissue.
Yeah. And I'll say if you are if you've tried dilators in the past and decided they weren't for you, or if you're trying them now and you're not sure, if you're having any kind of emotional component to that come talk to a therapist. A lot of times there is an emotional component. And I've talked with lots of people about feelings of fear of what if this hurts, or feelings of I don't want this to be a chore, right? If you like this idea, you could add in pleasure to your dilator routine. It doesn't have to be a dry, boring exercise. You could add in something that gets you aroused. You could add in a vibrator. There are things that happen in our body when physical arousal takes place, of like the cervix pulling up and out of the way, and lubrication and blood flow and all these things that would be really potentially helpful if you like that idea. And again, you also don't have to, right? You don't have to make dilator time this big, sexy experience. But if it helps, then that's great.
I love that.
Yeah, there's also the O nut, which is a little. It's almost like a. I think it's silicone. It's like a little silicone ring. And so for people who maybe have a partner with a penis and they want to try penetration, but they're noticing that um, too deep is painful, the partner with the penis puts the O nut around the base of their penis, and then that's a real nice physical reminder of don't go too deep, right? Keep it at the place that feels pleasurable.
Hmm. We actually have a set of those here at our clinic so that patients can not only hear you understand how, or hear you talk about how to use it, but they can feel it. So it doesn't seem like a scary
Great.
medical advice. They're very soft, very approachable. Um, Evidently, male partners don't complain about it. It feels like deep penetration to them, even though it isn't deep penetration for their female partner.
Yeah.
It's stackable, so it's customizable too. And they have a
Mhm.
new one that has a little tiny vibrator built into it. So there's a little bit of extra. I think it's for both partners actually, because you could put it where the clitoris would be, and then the partner is feeling it as well. Um, yeah, another
Yeah, I
option.
think
That's
those are great
great.
products.
That's great. And so many partners that I talk to are really worried about causing pain. And it affects their libido too, because they're like,
Mhm.
I'm constantly watching myself. I'm constantly worried that I'm going to do the wrong thing and you're going to be in pain. So nobody wants that. Let's
Right.
have some tools in there to help you so that you don't have to think about it quite so hard in the moment.
Exactly. Yep.
Yeah. So, what else do we need to know about aging and vaginal tissue, or aging in the clitoris?
Well, the tissue itself starts to thin out with age because we're not manufacturing as much of our own estrogen anymore. And so without the estrogen, the integrity of the tissue changes. It becomes thinner, it becomes less stretchy, it doesn't moisturize. It can be itchy, it can be easily irritated. And so that can make stimulation irritating. What didn't used to be rough now can feel rough. But also think about inside the vagina, the G zone has less sensation. It can take a lot more stimulation to have satisfaction on that tissue. That tissue is shrinking. The clitoris itself becomes less sensitive. The tissue surrounding the clitoris is also thinning out, more easy to irritate, but also it's more difficult to stimulate it and get satisfaction. So all of these things are age related because of hormone deficiency, and they can lead to frustration.
Well, so I have to say, I've been doing sex therapy for quite a while now. I was a sex educator before that. And of course, I don't do the medical side of things. But I have to say, you all over at Harmoni Wellness have some treatments that are new and exciting, and that honestly, I was not very familiar with before we all started talking. So, will you tell us more about the new exciting things that you offer?
Absolutely. Um, we have a platform that is specifically designed to treat women's health issues. And the two things that we use it for most frequently are to treat bladder incontinence, so women with laughing and leaking, sneezing and peeing. We'd like to treat that in the office and make it stop. Um, but that same platform allows us to treat vaginal tissue, labial tissue, all the tissue of the vulva and up inside the vagina to regenerate a patient's tissue. So, patients who have that thinned out menopausal tissue, itchy, painful sex, it is meant to communicate with the tissue and tell it to multiply, to regenerate, strengthen, have more blood flow and sensation. So it's absolutely indicated to help with aging tissue, tissue that's kind of stretched out or loose and lost sensation because of maybe a difficult delivery or multiple deliveries. If women feel like they just can't feel what they used to feel because their body's been through it and has changed, we have in-office therapies that are painless, that don't require, lifelong medications. There's no surgery. We are incredibly proud to be able to offer in-office treatments to help women feel so much better very quickly.
I love that. I love it because when we go back to that idea of, has anyone seen my libido? It's reassuring to know that there are resources out there and that there's all kinds of resources out there. Like you said, non-surgical, in office. You said earlier, you let your clients and patients guide the treatment. And sex therapy is really the same way. It's really all about you and your goals. And how do we get you to those goals? And how do we maybe process some of the emotions that come up along the way, or do some of that sex education that almost none of us got? That the sex education that's really about pleasure and figuring out what you want. If you have partners, how are you going to communicate that to them? Um, that's the really good stuff. And I feel like one of the things that helps people get their libido back is having some confidence of, oh, it's not just me that this is happening to. And this is something that's really common at various different points in life. And there are things that I can do about it, and I get to be in control of what I decide to do about it. Yeah.
Absolutely agree.
Absolutely. Mm-hmm.
Yeah. Well, so where can people find you all if they want to get in touch?
So we have a website that it's Harmony with an I dash wellness.com. We have a resource page. We have an events page. So would love for people to visit and see if there's something that's appealing. We also have a media page where past interviews and articles and things. We also are on Instagram and Facebook. It's Harmony with an I. Wellness MN. That's our handle.
That's great. That's wonderful. And if you're looking to get a hold of me, you can find me at laurarademacher.com. I am also on Instagram for now. We'll see. Social media, I always go back and forth with myself of, am I going to do it? Am I not going to do it? But if you're seeing this, you might also be seeing it on my YouTube channel. Who knows? So there's lots of ways to find me as well. And no matter what, please take good care of yourself and do whatever is going to get you closer to finding your libido if that's what you want to do. Make the choices that are going to be helpful for you. So it's been so good to talk with you both. Thank you for being with me today.
It's an honor to be here and to learn from you as well. So thank you so much.
We were so pleased you invited us. Thank you so much.
Oh, yeah, it's been a great conversation. I really appreciate you too. All right, have a good